Primary sclerosing cholangitis has very interesting associations with certain other disorders. Since it is a primary disorder, so there has been established no causality that these diseases do not cause this disorder, but these are very commonly found along with primary sclerosing cholangitis in certain patient populations. The most interesting and the major principal associated disease with this disorder is the inflammatory bowel disease. Inflammatory bowel disease, as we all know, is basically a term which is used to describe both the Crohn's disease and ulcerative colitis. Specifically, of the two, ulcerative colitis has been found to be very commonly associated with primary sclerosing cholangitis. So much so that primary sclerosing cholangitis is the most common form of hepatic or hepatobiliary disease presentation in patients with ulcerative colitis who present with jaundice or with problems of the bile flow. And in about 70% of the patient population who have primary sclerosing cholangitis, they were found to have underlying ulcerative colitis. And based on this disease association, a few pathophysiology has also been postulated that there is that the gut flora undergo certain types of transitions in patients with ulcerative colitis, and because of these altered gut flora, they can cause damage to the hepatic ducts. Since there is no definite pathophysiology documented or known for to cause primary sclerosing cholangitis, so these associations carry a lot of weight if you look at the percentage of the population that have both the disease presentation, ulcerative colitis and primary sclerosing cholangitis. One other important thing to talk about here is that the patients who have both ulcerative colitis and primary sclerosing cholangitis, they are at increased risk of complications of ulcerative colitis, the most important one being the colon cancer. So the colon cancer is found compared to other people who do not have primary sclerosing cholangitis in association with ulcerative colitis. The population who have PSC or this cholangitis, they are found to have at an increased risk of colon carcinoma. And similarly, the patients who have primary sclerosing cholangitis and along with ulcerative colitis, they are found to have an increased risk of cholangiocarcinoma, which is the cancer of the common bile duct or the hepatic duct, and along with the cancer of the gallbladder. So basically the take-home point is if both of these diseases are present simultaneously in a person, then that eventually carries a worse prognosis. Certain other types of associations which are not very commonly found with primary sclerosing cholangitis are the different types of fibrotic diseases. Since sclerosing cholangitis is itself a fibrosis or a fibrotic disease, other fibrotic diseases like certain systemic diseases with fibrosis or the collagen vascular diseases, the diseases which have retroperitoneal fibrosis, certain types of immunological disorders, they are found to have slightly more common. They are found to be slightly more common or have a slightly more prevalence in patients with primary sclerosing cholangitis. Certain infiltrative diseases like histiocytosis X or HIV associations have also been established, but they are very rare, less than 1 or 2%. The major association, if you have a patient with primary sclerosing cholangitis, is you should always work up that patient for underlying colon problem, IBD specifically, more commonly ulcerative colitis than the Crohn's disease. The other associations are very far, and if they have certain symptoms that are depicting these fibrotic lesions, then you can work on them. So the take-home point from this slide is the principal disease association of IBD with primary sclerosing cholangitis.